Hi, hello everybody. Welcome back again to our channel. And the question that we are going to discuss today is overjet and overbite. Very important from prosthetics and preclinical prosthetics point of view. Overjet, going to the definitions once you open the thing. Overjet refers to the horizontal distance between the labio-incisal surface of mandibular incisors and labiolingual surface of maxillary incisors. The overjet refers to the difference between the labio-incisal surface of the mandibular teeth and the palatal surface of the maxillary teeth. This difference is the overjet. Okay, that is about 0.40 to 0.4 mm in normal set of occlusion. Overbites refers to the spaces in the vertical distance within the maxillary incisors overlap the mandibular incisors. That is the overbite. This is the vertical distance by which the maxillary incisors overlap the mandibular incisors. The significance is this normal relationship. This is about 0.6 mm to 1 mm, 1.2 mm even. This is essential for normal incisal guidance of occlusion, meaning this relationship has to be recreated when it is this incisal relationship and correlation, the crown angulation has to be followed, because the crown angulation, the upper incisor is kept slightly buccally inclined, whereas lower incisor is straight or slightly lingually inclined. This will help for the crown, and the upper incisor has to overlap always the mandibular incisors. If this is not happening, what will happen to the incisal guidance of occlusion, meaning the upper arch should cover the lower arch. The presence of the lower incisor will help the upper arch or act as a stopping point so that it does not come to posterior. Similarly, the presence of the stoppage of the upper tooth will help to prevent or open up the mandible at an established vertical dimension. So, since such that the tooth does not open beyond its capability when in contact. That is most important. You cannot close and open or push the mandible outside. That kind of guidance or occlusion will happen with this normal overjet and overbite only. Next is the crown angulation that we discussed. Crown, upper crown is slightly labially placed. The lower crown is slightly lingually inclined. This together contribute partly to the aesthetics of the incisors also. So this is your overjet. Reduction of overjet will cause damage or trauma from occlusion. Increased overjet will cause spacing and malocclusion. So overjet and overbite has to be in the optimum level. If there is increased overjet, the upper crown, it will be spaced apart. It will be a class 2 or a class 3 relationship if it is plus or minus. Overbite will cause trauma here or damage here, leading to early damage to the periodontal ligament apparatus of both the incisors. Not only that, the established vertical dimension will be lost. With that, we come to the end of this discussion on overjet and overbite. That was the clinical significance also. Stay connected with this channel to learn more questions. Till then, learn incrementally, at least one question a day.